We have a partnership with a company called Turquoise Health, which is all about price transparency, that take this data, clean it, structure it, and give us benchmarks for each of these procedures in every zip code, in every state, in every metro, by hospital. So we know when we go to an employer to say, okay, this is what you're paying now, right, per this data. This is what we can offer it for. This is what we predict the savings would be. And by the way, your employees will get a better experience. And by the way, they go to higher quality doctors than average, so they should have better outcomes. By the way, they have a nurse throughout this process. And the way we work is we have to generate savings in order to make money as a company. And transparency is a really bedrock for that. And that's how the US healthcare system works in the commercial space, and why there's so much opportunity to do things. So in the last few years, one of the few areas of bipartisan support in the United States is around price transparency. So there have been a set of laws over the last decade with increasing teeth and requirement. And today, both payers, meaning insurance companies, and hospitals have to disclose their negotiated rates across their full range of procedures. And this is, sometimes you call it price transparency data, or some people call it MRF data, machine readable file data. And we use that data. Now, I think the data is now available. Now, how to make it actionable is the next step, if that makes sense, because it needs to be cleaned. We have a partnership with a company called Turquoise Health, which is all about price transparency, that take this data, clean it, structure it, and give us benchmarks for each of these procedures in every zip code, in every state, in every metro, by hospital.
I didn't know that. And I've been in this industry for a long time.
We're only like 1/30th of the population of the world.
I think sometimes we just think that we're the only ones that exist and matter. It's like there's that kind of.
I'm honestly surprised we have 13% of the best hospitals.
Yeah.
17 or whatever number you just said.
So do you see, are there certain countries or cities that are especially good in gastro surgery or cardiology, or, certain specialties?
Yeah, I think it's more of a function of there's certain parts of the world that can provide very strong medical care more generally, right? So, a lot of our partnerships are in Asia, for example. So Korea, Japan, India, and others, Singapore, they can have exceptionally good hospitals that are, top 250 hospitals in the world. And so when you think about, sort of break free of that constraint of care just needs to be local, to say, yeah, care can be local. Lots of people want that. Most people want that. But if you think about care opportunities from a global perspective, you can really provide access to the top 1% doctors and hospitals around the world. You can greatly lower costs. I can give you some examples, like a heart surgery. I live in New York City and I'm a cardiologist. A heart surgery, bypass surgery, blocked blood vessel open, that can be like $200,000, $250,000 in New York City. Top hospital in India that's better than 99% of US hospitals, it's less than $10,000. And if you just pick places around the world, it's just incredibly different. And most people just don't know that because the prices we pay in the US are very, very high.
I remember when I was working in the value-based care space, when it was kind of a new, kind of novel idea. It was about, I'm going to say back around 2010, bundled payments was a big part of that. And that was just like simplifying.
100% simplifying.
Yeah.
And without the bundle, it's really hard to know, well, what am I truly paying, right? Because it's not just there's like 400 line items from an inpatient or outpatient stay. It's just even totaling that up, getting that data from your payer, taking out the noise data, inaccuracies. It's not easy. So it's much easier to have a conversation around value if we're just like, well, this is the total bill.
And just simplify.
Yeah. Healthcare is complex, right? That's why we're trying to.
In a lot of ways, it doesn't have to be. Like a complicated surgery is a complicated surgery, but the billing process doesn't have to be complicated around it.
Transparency into basically benchmark rates, transparency into what we're spending and the savings that are generated as a result. And then with all of this, not only are we picking what we think are the best doctors, whether it's going to be for cancer care, whether it's for a gallbladder removal or whatever, We are collecting a standardized data set across the globe, which we believe in the next 5 or 10 years will be the largest global comparative effectiveness data set on doctor quality. So just like you can go on Amazon and look up the rating, or Airbnb or Verbo or this or that, how many stars did that property get? And what were what did they have to say about it? The people who stayed there. We're going to be collecting, and we are, a longitudinal clinical data sets.
Thanks for joining us on the Healthcare Uprising. Make sure to hit those like and subscribe buttons before you go, and take a moment to think of a friend and hit that share button. You can find us on all the major audio platforms, and we've got video on YouTube and Patreon, patreon.com/healthcareuprising, if you want to watch us in action.
You can also find us on social media on LinkedIn, Blue Sky, Instagram, and Facebook. Just search Healthcare Uprising to find us. And if you're a new company or a creator with a cool new product for the healthcare space, or if you're someone with a personal healthcare journey and you'd like to share it with us here at The Uprising, please email us at healthcareuprising@gmail.com, and we'll get back to you about coming on the show. That's all for this dose of Healthcare Uprising. Till the next time, keep looking for the good in the world, because sometimes it's where you least expect it.
This has been a Shut Up production.